Welcome to the Barrier Breakdown, Disrupting Mental Health podcast, where we talk about the clinical and practical issues that face those working in the mental health industry.
Hello, everyone, and welcome to this week's episode of the Barrier Breakdown. My name is Erin Molyneux-Bailey. I'm the Chief Operating Officer at Cognitive Behavior Institute, and my co-host, Dr. Kevin Caridad, who is the CEO and owner at Cognitive Behavior Institute. Today, we are very excited to have our guest, Dr. Maggie Mulqueen, and we are going to be discussing cancer culture and therapy. Maggie is a psychologist in Brookline, Massachusetts, where she has maintained a private practice for over 30 years. She is the author of On Our Own Terms, Redefining Competence and Femininity, and most of her work can be found at drmaggieMulqueen.com. So Dr. Maggie, thank you so much for joining us here today on the Barrier Breakdown. Very excited to discuss cancel. Hold on a second. So thank you so much for joining us today on the Barrier Breakdown. We're very excited to discuss cancel culture. Can you share with our listeners a little bit about what path led you to mental health?
Sure. Well, good morning. Like many people in our field, it was my own going into therapy for the first time that began my interest in the field. My first therapy experience was when I was a sophomore in college, and it opened my eyes to a whole new way of thinking about myself and the world. And I'm a woman of the age of prenatal 9, so really the options, that I thought were available to me were to be a teacher or a nurse. And I was studying education as an undergraduate, and it really was not where I wanted to be. And through the process of my own therapy, I came to be inquisitive about, was this a field that I might be interested in? And so I made that choice for graduate school. And I went from undergraduate straight to graduate school and decided to pursue the world of psychotherapy. And I feel like I'm one of the lucky people for whom, my work life is really my calling. It has been a great fit for me. And I love my work. So.
Yes, wonderful. And I know that we mentioned in your bio that you've been in private practice for over 30 years. And can you tell us a little bit about working in private practice? Is that what is your true passion as far as, clients in that environment?
So when I started out, when I was in graduate school, I thought I was going to be an academic, and I looked at academic positions, but I made the decision that really although I was working on my own book at the time, that doing research and stuff didn't speak to me as much as working with people. And so I've done many things, which is one of the greatest things I think about being a psychologist. I mean, I have taught, I have, worked for organizations. I've had my own practice. I've been able to do a multitude of things, to write. And one of the reasons I so appreciate private practice, for many years I was a college counselor, but there you're really set to the academic schedule. And so there's great turnover, and private practice allows for a depth of conversation that is frankly almost unique anymore in this society. I mean, I've known people for years and years and years, and that is deeply fulfilling to me in terms of finding the meaning in my own life. And one of the things I also like about private practice is that it's my own business, and that's been a really important thing for me as a woman, to grow into understanding what it means to run a business, to be able to talk to people about all the things that go into that in terms of, having my own office and charging people fees and collecting money and figuring out that I'm a business owner, and that's not taught in graduate school. and
I think Dr. Caradad can say amen to that.
and how to learn to present myself and manage that. But I really do love the autonomy of, and it's not for everybody. I mean, private practice can also be very lonely, but I have really flourished with the autonomy over these years.
Wonderful. And let's talk a little bit about how cancel culture has made its way into therapy. What are your thoughts on that?
So, it's not a term that I love. Let me just say that.
Neither, because I keep pronouncing. I keep stumbling over it, and
right.
It's Monday. Maybe I haven't had enough coffee. I'm not sure, but in my head it's very smooth, but on my tongue it doesn't really like it as much.
Yeah, I mean, it's not a term that comes naturally to me either, but it is the vernacular, and so I think the ways in which it's, there's a bit of a chicken and an egg, right? In what ways does therapy reflect the culture, and in what ways does the culture reflect therapy? I mean, when people are interested in therapy, I mean, there's a give and take here. And so what has become increasingly concerning to me is the premise of therapy is trust. I mean, it's establishing a trusting relationship with somebody. You can't have an effective therapy relationship if it's not grounded in trust. And part of that, how we establish trust with another person, is the belief that they will give us a chance, right? So if there's a disagreement or an impasse or a conflict, you will give me an opportunity to explain myself, and I will be listened to, and you can trust that I will listen to you. And that really flies in the face of what cancel culture is about, because cancel culture is saying that if someone has erred, that means that there will be a rush to judgment rather than an attempt to be helpful. And for certain egregious acts, there's probably supportable reasons for doing that. But within a therapy relationship, when people come in so worried about being judged rather than being heard, I think it has challenged how you establish that trust, because now a therapy relationship looks ever more different from their other relationships than it used to. And the fear of, being judged is much higher on everybody's mind. And I think cancel culture is, an extension beyond political correctness. It's, on a very simple level, one first thing is when people come into therapy, they often worry, can they curse? They'll apologize. They'll say, they'll say something and then they'll say, oh, excuse me. And I give them permission. It's like, I've heard these words before and it's okay. But it's letting people speak how they speak allows them to then deepen the conversation.
Show their authentic self.
Exactly. Or learn what is our authentic self.
Sure.
Well, that's an interesting, no, I think that's an interesting piece that you make. As a therapist myself, I think you kind of summed it up there in a way I hadn't thought about it, that clients coming in are very much heightened just like the rest of the world, but that impacts the ability for us, our common factors, be able to connect with them and them feel free because of their life experience about what that's going to be, and kind of make some assumptions based upon the therapist. And it makes it that much more difficult, interesting enough.
That's right. And I think also as a therapist, for me, in terms of how we might listen, or what we might suggest, or what we might feel are options for somebody, we also have to be realistic, that there really might be much more dramatic impact if somebody speaks up to their boss, or if a boss speaks to, an employee than there used to be. That fear is real. That's not all in their head. That's not all an intrapsychic issue. The consequences these days, the availability of social media, the concerns about hiring practices, Title IX issues, all of that are very real and need to be taken seriously. Because I work in the Boston area, a number of people in my practice are academics, and what it means to be teaching in a college environment right now is different. It's not all in the professor's head that the concern about what will happen with student evaluations or what their syllabi, the requirements of their syllabi to, how they present their material. So I think it's a dance that we need to be honest is happening and acknowledge, and then talk about how within a therapy relationship we're going to manage that so that we can trust one another.
No, I agree. I think, you look to myself in more recent times, and even in intervention like exposure-based, a typical exposure that comes to mind that I would make someone do, and kind of brought it up as an example, but it was specific to one gender I was discussing with another, and they actually didn't receive that well. Their concern was, and I could understand from their perspective, I should have given it more thought. But typically that had not been an issue with either gender up until that point. On the other point is the sense of advocacy versus client-centered ethics, with at least in the NASW Code of Ethics. Where does advocacy go? Where does the client go? Particularly depending upon if a client says things that is offensive. What is the role of the therapist in there? And that's even been controversial in discussions, even internally, about letting people make their decisions. But where do you go with that? It has become more complex on all levels.
Totally, and I think. Who gets to decide what's offensive, right? And how is that understood is really important, because there are times when people say things to quote unquote let off steam. And that's, in the past, we've been supportive of that. But now there might be consequences to that are very dramatic. And to go back to something you said earlier about assumptions, I think that's also, I think about, I don't know if this is a topic you want to veer into, but I think about the day Trump was elected. I mean, every person in my office that day was crying in the waiting room before their session. And they kind of had an assumption that thought I would agree with them that this was a bad outcome for the election. Now, I actually know that there were people in my practice who voted for Trump. That's not something they would make public given where I practice and, blue Massachusetts. But where do we go with that in terms of nodding in agreement with clients, or also challenging them about how those assumptions are helping them or not helping them in terms of a group think? That can become quite dangerous. So,
particularly in Western PA, it's quite conservative. There's a big mix leaning more towards Republican. So we had, I think, both political parties coming in at one point, or depending on the election, we kind of get that on both sides. And it's right, because, can you relate to the client? Can you walk through their shoes? But where does it become not genuine, or is it not genuine, even if you can relate to them and you have different views? So it's interesting times. And one of the things I agree with is, I wish during an inflection point in society like this, there would be some level of forgiveness or flexibility to allow people to make mistakes. Even for kids, let's take it down to that level where we know they make mistakes more so than others because they're going to learn. But the consequences of such are so adult-like in the academic school setting and such. It can be very harsh, and I've seen many examples. It's not a difficult time for anybody, and I wonder if that's reflective in all the mental health rates, suicide rates, and everything we're seeing, that inflexibility.
Mm-hmm. Oh, I think very much so, and I think it's also the difference of that in our current time. There's so little distinction between private and public. I mean, you could have a mistake before, and it would be a very small circle of people who would know about it, and that's not true anymore, and it's instant. And I would also underline the use of your word learn. I'm not sure what children are learning. Are they really learning why those thoughts, feelings, expressions, or are they just learning to cover them up and to not say them? And that's where I feel like therapy rooms, ironically, are becoming almost the last places people can speak the uncomfortable, the not politically correct thing. But then within that, what happens if someone says things, or I say things as a therapist that are offensive to the other person? Can there be forgiveness? Like, in previous days when, I don't think every therapy session means that the client walks out happy. So I have to be able to tolerate when someone's unhappy with me. But
it's a good
be
learning.
afraid that they're going to go on social media and say, this is the crappiest thing.
Here comes your Google 1-star review.
Right, exactly.
No, I hear you. But, I have found one example comes to mind where a client just knew I was on vacation and asked how vacation was. But, and I was so conditioned in school not to talk about personal life. I kind of just cut it off. So I really don't feel comfortable talking about it. And I could just see the shades of the whole demeanor change. And I'm like, oh, I stepped into it, which I quickly went around and fixed and say, hey, I apologize. I kind of explained why I did that. And then, I've seen that client for a long time afterwards. And I think it was a good learning experience. So I was human. What my intent was, got to explain it. Seemed like they accepted, they stayed for a long time, particularly in that person's world. Not a lot of that apologies and making mistakes were going on. So it was actually very therapeutic for me to screw up, in a sense, if you want to say, or walk into something I didn't know about. And you're right. I think it's much more challenging now about how you go about that, and where areas of gray maybe aren't so gray to any one particular individual at this time. It's more black and white. Makes it much more complicated.
I also think we don't get as much practice to do the forgiveness, to have the, uncomfortable conversations. I mean, if people are being shut down or afraid to speak out, then, what in terms of helping people, it's really, helping them with that skill set of how do you have difficult conversations? And if you're not able to practice it because you're afraid of making mistakes, to your earlier point, mistakes are not seen as forgivable, then we're only going to make the situation worse, because people then don't know how to have a conversation and to ask for understanding, or to put themselves in a position where they're willing to learn.
No, it's a good point.
And then does that cause them to refrain from exploring those thoughts, obviously, because, there's fear, like you had mentioned.
And that fear may not just, and I really want to emphasize this, that fear may not just be, an intrapsychic issue. That fear might be very real right now in this society. It could be based on the fact that they've seen somebody else in their, workplace get shunned for making the off-color joke, or speaking out of turn, or standing up to somebody who made the off-color, being called a snowflake or what, it goes both ways. And I think that really needs to be appreciated, that this is, there isn't only one end of the continuum on this issue about what's acceptable and what's not acceptable anymore lives on both ends of the continuum. And that's part of what I think makes it so hard for us to work with it.
Well, and
go ahead, Erin. Go ahead.
We're both excited. You make a great point when you talk about speaking out against something, because sometimes, let's talk about the silence piece too, because if you're not,
right,
if you're for something or you're against something, but if you don't choose and you don't tiptoe that line, that sometimes also has an impact on your reputation or how others view you.
Exactly. Right. I mean, because, like right now, we're having this conversation while the whole Supreme Court issue of Roe v. Wade is very much in the forefront. And many people would say, on that issue or the climate, the time is gone for you to be a silent observer on the sideline. And to go back to your earlier point about how we might have been trained in graduate school about being, kind of the blank slate, that position is far less understood and appreciated in this current culture. People want the litmus test first to know if I can trust you with my inner thoughts and feelings.
Yeah, there's a lot of, it's either this or that. How do you prime your clients, your new clients or current clients, to kind of, for what you're talking about, creating an environment of exploration?
What was the first word you used?
how do you prime them? How do you get them ready or to set the environment to hopefully make it therapeutic for them? Or to allow that to happen, whatever that is.
Yeah, it's a great question. So the first thing I would say is that, I do what we're legally and ethically bound to in terms of explaining HIPAA and making the distinction about, what will be shared and what are the conditions under which I would break confidentiality and share information, and then assure them that I would not break confidentiality for any other reason. So to really, a first session never ends without me doing a pretty detailed explanation of what that is. And if it's someone completely new to therapy, I also make sure during the first session to explain to them how the therapy process works, and what they can expect from me and what I expect from them. So I see it as a teaching moment. I don't expect people to come to therapy and understand how it works. There's a learning process to, I think, how to use therapy effectively. And part of my role as a therapist is to help teach somebody how to make the most out of being in therapy. So I see it as a teaching moment as well. And then I think some of it is modeling. So for example, if someone wants to use profanity, I may mirror that and use some myself to relax them, that they don't, that kind of, it's like when people go to the doctor and think, they have to use the technical term for a body part that they never use any, it's like, we don't have to do that in here. We can have a more, I'm interested in how they use language rather than me ascribing that. But I think the fundamental trust in a therapy relationship is we show up. I show up week after week. I'm there on time. I'm ready to listen. The way I had to adapt with COVID, but in my office, there's an atmosphere that says this is your time and I'm here for you, and I give my undivided attention, which is again a unique thing for people these days, to have 50 minutes of undivided attention, and encourage them to give themselves the opportunity to not be multitasking during a therapy session. And I think over time you get traction for that.
You mentioned COVID, and I guess I'm interested also, prior to COVID, were you strictly doing face-to-face sessions, or were you doing any telehealth?
I only did, it was strictly face-to-face. There'd be the occasional telephone session. I got introduced to Zoom during COVID because of COVID.
Just like everybody else. Yeah. Okay.
But I did some telephone sessions, if a client couldn't come in because they had a sick child or they were, vacationing or something, but basically it was completely face-to-face.
Gotcha. And how did, are you doing both face-to-face now and in telehealth, or?
I am. My practice has really changed. I go into my office one day a week for in-person, and although I put that on pause during the Omicron surge, so it varies a bit depending on where COVID is in my area, and my other 3 days I do remote. So I see patients 4 days a week.
Okay. And have you noticed any changes in that trust relationship from being virtual to being face-to-face? Tell us a little bit about that.
So initially, I was at a point where I wasn't taking new clients on. My practice was full, and so all the people who I went remote with, I'd already known them and met them in person.
Sure.
COVID has lasted long enough, and so that I have taken on some people who I've never met in person, and I do feel that difference because one of the things watching somebody in my waiting room walk into my office, right there, I learn a lot, just in their body language and how they carry themselves and how they sit on the couch. And you don't get that on Zoom. So there were some people who chose to only do phone. They didn't want the visual for a variety of reasons, privacy, whatever. And about 6 months into COVID, I said to all of those people, I want one session where there is a visual, because I did not trust that necessarily what they were telling me was the full scope. And I wanted to make sure that my visual of them lined up with what I was hearing from them. And then I said, I'm happy to go back to phone, but I'm going to occasionally say, I want to have a visual, because I would, in the olden days, I would always have visuals. And
Sure.
and I thought it was important to challenge that a little bit. The other side, some of the positives, if you will, that came in terms of trust was people could present. It's always one of the issues with individual therapy, right? Is you only get one side of the story, and people could present very differently when they put themselves together and came into my office. And through Zoom, I was invited into their homes, and the trust went to a different place, because, I saw people in much less polished, some people, therapy sessions in their bed, in their bedroom, because there were 3 children outside knocking on the door. And the boundaries shifted, and we had to trust one another differently, I think, in that level of intimacy, that it wasn't going to be quite as, the boundaries were not set in the same way.
Yeah, that certainly makes a lot of sense. And I could see how, like you said, that opens up a whole new level of exploration, even seeing their environment. And
yeah, I met members of their family. I mean,
here's my dog.
Yeah, exactly. Or somebody, opens
the door, right?
Right. I didn't know you were in there,
Yeah, sure.
Right.
No, I'm sure there could be a whole series on that. So, Kevin, did you have anything else you wanted to mention or wrap up here before we?
No, I know Maggie has a book. If you could talk a bit about the book, I'd like to hear about your book.
Sure. Thanks. So my book came out of my doctoral thesis, and then I did a follow-up study. And the question in my book was looking at the notion of our sense of competence and sexual identity, because in our culture, competence is associated with masculinity. And so through in-depth interviews over longitudinal time, what I really examine is the question is, how can a woman feel both competent and have a positive sexual identity in our society? Because they really stand typically in conflict with one another, and both are important ingredients of self-esteem. And so what I propose in my book is a new fashion for understanding and defining competence and femininity in such a way that women can have both contribute to their self-esteem rather than being at odds with one another and diminishing their self-esteem.
Awesome. How would someone find the book if they wanted to go and purchase it?
It's old, but it's still available on Amazon these days. But it is still it's still in print. So
wonderful. Well, thank you so much for the time today, Maggie. We certainly appreciated this. This was a great conversation, and it'll be interesting to see how this continues to evolve over time.
Very much so. Thank you both.
Yes. Thank you so much. And to our listeners for the Barrier Breakdown, thank you so much for joining us this week with Dr. Maggie Mulqueen, and we will see you next week. We hope you all stay safe and healthy. Take care.
Thank you for listening to The Barrier Breakdown, Disrupting Mental Health. Listeners can find all of our episodes on YouTube, Apple Podcasts, Spotify, and Podbean. For more information and to learn about upcoming continuing education events, check out our website, cbicenterforeducation.com, our Facebook pages, Cognitive Behavior Institute and CBI Center for Education, as well as our Instagram at Cognitive Behavior Institute and our Twitter at CBI_Pittsburgh. Don't forget to like, comment, and subscribe. We hope you'll tune in for another guest next week.